So we can go up here. You've all been on the diet. Who wants to go first? You want to? Okay, hop up there. Then we'll go over there too. Go ahead. So describe your, stand if you don't mind.
Sure.
What's your first name?
Lisa.
Lisa, talk to me about your experience. Have you been hungry on it? Is it difficult?
The first 2 days, maybe I was a little bit hungry, and then I ate a lot of greens, as Dr. Emma said. It did fill me up. Drank a lot of water, and I definitely had a lot more energy. I felt a lot better. It came off quickly, and I've kept it off.
And how much is it? How much weight did you lose?
15 pounds.
15 pounds. Perfect. And you were on for how many weeks?
I was on it for 3 weeks.
3 weeks. Okay. Now you had a question. Go ahead. Pass it over there if you don't mind. Stand if you don't mind. Introduce yourself.
I'm Mary Jo, and I'm from New Jersey, and this diet is amazing. I tried every national known diet. 5 months on one, I lost 1 pound. I found Dr. Emma, and in about a 6-week period, I dropped about 30 pounds, just shy of 30 pounds.
30 pounds?
Yeah, I'm very happy.
Right, so nothing of this extreme nature, in my opinion, could be without some side effects. Any complications, any nausea, headaches? Everyone loved it.
No, I was having severe headaches for, I think it coincided with the weight that I was carrying, and my headaches went away. When I'm taking the HCG, they're gone.
Right. So what I wanted to do is bring this alive for you. So I want you to meet Michelle. Now, she's lost more than 50 pounds, so more than the two guests that we have here in the audience. Take a look at her day in the life on this diet.
This is definitely the best diet I've ever been on. This is what I do. First thing in the day, I take my HCG shot. They subside any kind of hunger. I had a lot of anxiety the first time I had to give myself a shot, but now it's just second nature, and when I see the results that I get from taking the shot, it's just worth it. After I do my shot, I have my breakfast. It's just a cup of tea. It totally satisfies me, and I'm never hungry. The hardest part was giving up dairy and carbohydrates, butter, oil. A typical lunch consists of 3.5 ounces of protein and vegetables. I probably used to eat about 1,500 calories a day, and I went down to 500 a day. At first, it was a little bit of an adjustment, but you have to be disciplined on this diet, otherwise you're not going to lose weight. People say that you're not eating enough, it doesn't seem normal, and I just don't listen to them because I know I'm not starving myself, I'm eating properly, and I'm eating enough. When I started the HCG diet, I'm so much more confident, and I just have a totally different outlook about myself.
So Michelle, talk to me about this. You have just a few shrimp you point out there. You savor them.
I do. The diet, it seems like you're not eating a lot, but those 6 shrimp that I have for dinner, it fills me up, and it's teaching me portion control for when I go off the diet, that I'll eat less. It's just, I'm used to eating that less now, so.
And what does it cost to be on this program?
It's, for a 6-week program, it's approximately $800.
$800?
Yes.
So Dr. Emma, what does a patient get for $800 for the treatment?
When a patient comes in to see me, I take a very thorough medical history. That's usually what I start with. Often that lapses right into a personal history, talk about all the things that they've tried that haven't worked for them. And we also take into consideration any medical conditions they have. We do a full panel of blood work, look at hormone levels, we look at vitamin deficiencies, any medical issues we need to address. And then we go and do their body composition, measurements. All of these values are very important as we track their progress.
Now, I was struck by the daily injections. I didn't realize it had to be every day. So again, you know, it's a needle, and you actually get a prescription from a doctor, and they advise you, educate you how to do it. What do you think about the droplets? I see these on the internet a lot, and I see them being used quite a bit.
Well, most of those drops we see are called homeopathic drops, and for those to be labeled homeopathic, they can only contain trace amounts of the hormone to be legally sold as homeopathic, because this is a prescription drug. So anyone who buys those over the internet are really just getting trace amounts. It's not pharmaceutical grade.
So do you use those with your patients at all?
No, I do not.
Okay. Part of the reason I got interested in this topic is I met someone who was on the diet. It's often what stimulates any healer in their pursuit of trying to spread the word about what works and what doesn't.